Medurstand-Understanding Medicine.
Professor Aziz Rehman from Medurstand. In our series of videos on clinical methods, today we're going to start with the central nervous system examination. And I must confess that this is the most difficult part. Out of all four systems, general physical examination, cardiovascular, respiratory, gastrointestinal, central nervous system is the most difficult one, and you really need to develop expertise to be able to conduct these clinical methods. And I've learned that medical students, they tend to avoid it. That is not right, because you are going to confront with a patient who might need very, very critical CNS examination, and only then you will be able to reach a proper diagnosis. CNS, the central nervous system, is unique because it has got very, very different structure and different functionality. And to understand and to be able to do the test, you have to know the anatomy also. In my associated video, the clinical method video, which covers the theory part, I have given some outline of the anatomy, and I'm not going to cover it here. But you definitely need to know the anatomy of the brain stem, the peripheral nervous system, the autonomic nervous system, and all cranial nerves, their origin, their path, and only then you will be able to, and their function, of course, your function of all those cranial nerves, only then you will be able to do the test and interpret the findings. So we are going to start with central nervous system examination. It starts with higher mental function. And actually, there are some specific tests which are done to assess higher mental function, but those are usually done in neurology departments. In internal medicine, we just assess the higher mental function during our interview. So when we're taking history, if patient is very well oriented in time, space, and person, patient can speak well, patient can understand your question, patient answer them well, and patient is fully alert. So I think we assume that higher mental function are okay. So I'm not going to demonstrate the method of higher mental function evaluation here. Then speech is another part. Speech is also evaluated during interview, but speech is very, very complex function of the brain. It involves understanding the spoken language and ability to express in spoken language, and it covers the ability to interpret the written words or the signs, and also the ability to express in writing and in expressions and in signs, making gestures, understanding gestures. So it has got very, very complex function, and I think if patient can communicate well with you without any problem, you can again assume that the speech is intact. But in neurology clinics, they would have very, very formal tests for different components of speech. Speech has got a sensory part, the input, and the motor part, expression part, and then the central processing unit. So there could be problem anywhere. So that is one thing, and then there is slightly different thing that is called articulation. There could be problem with speech, or there could be problem with the articulation. If somebody is unable to have articulation, that is called dysarthria. Sometimes due to paralysis, a patient can understand what you say. Patient also know what to say in response, but he or she is unable to say that. That is called dysarthria. So that is usually a sign of a nerve paralysis.